Matthew Johnson. I'm a professor of chemistry at the University of Copenhagen, and I've started to work with innovation and especially with air quality, and this has led me to develop several companies, and one of these is Rensair, and Rensair is making these air purifiers. So I would like to talk to you today about indoor air quality and the links that there are between health and indoor air pollution. So this is an outline of the talk. I'd like to define some of the things you need to know about indoor air pollution. We'll talk about ventilation and air purification. I'd like to tell you about the Rensair products and the certifications that we have. And finally present some case studies and a conclusion and summary. So to start this out, people do spend a lot of time indoors. And studies that look at how people spend their time show that we spend about 90% of our time indoors. So there's outdoor air pollution, but the indoor air pollution has much more of an effect on human health. And the indoor air can be 2 to 5 times more polluted than the outdoor air, because we're doing things like cooking or smoking or cleaning, and the scents and the perfumes that you might have in cleaning products, these can generate indoor air pollution. And certainly in the medical setting, you have the possibility of transmission of disease through the air. And so all of these things together mean that we really need to think about indoor air pollution. It is one of the top 5 risks to public health, and it's a cofactor in about 50% of illnesses. So it really is a fundamentally important thing to think about. This is some data that's just been put together, our world in data. This is listing the disease burden by risk factor. And so this is showing the disability-adjusted life year. And it shows that in 2019, there were 213 million disability-adjusted life years lost due to air pollution. This is both indoor and outdoor air pollution. That means that it's second on the list of all of the risk factors. And I think people simply aren't aware of what a large risk air pollution is. This means that it's now larger than smoking or high blood sugar or obesity, and some of the things that I think we spend a lot of time and resources fighting. We should spend as much time and resources thinking about indoor air quality. This has led the World Health Organization to greatly reduce their recommended exposures for air pollution. And so they had some recommendations. These were put into place in 2005. In 2021, they made these much more strict. So for particulate matter, this is PM 2.5, shown on the left, they've reduced the exposure by half. It's now about 5 micrograms per cubic meter of particulate matter in the air. And I would guess that in a room like this, we're right about at that limit. And perhaps it's a very nice day outside, clean air outside, and so we're probably also right around that limit, but it's very easy to exceed that limit. Another factor is nitrogen dioxide, and you often find this in urban environments where you might be using diesel fuel. And so here, this has been reduced by a factor of 4. And the goal is to save lives, and globally, about 8 million lives are lost every year, about evenly divided between indoor air pollution and outdoor air pollution. And this is about as many people as have been killed in the COVID pandemic that are killed every year due to air pollution. If we look in more detail at particles that we have in the atmosphere, you see that there are many different sizes that we talk about, and these start with the very smallest sizes, which are on the size scale of individual molecules. And so you could have polycyclic aromatic hydrocarbons. These are carcinogenic compounds, benzene, things like that. And then these can cluster together in order to make very small particles. And then we start to come into the range of particle sizes that we're familiar with. This could be candle smoke, jet engine smoke. Viruses are coming in at around 10 or 100 nanometers. And then you go through several orders of magnitude and you come to the sizes of things that we think about more commonly. Pollen allergies are coming at this time of year, and human hair and flower dust. And all of these have different properties, different lifetimes in the atmosphere, different ability to be deposited into people. And a lot of them are biological, and these could simply be things like pollen or viruses, but they're also coming from pets. So you have pet dander. There are spores. They've found a lot of bacteria even in the stratosphere. So all of these things are spreading throughout the environment, and certainly a lot of them are unique to indoor air. Now, my high school biology teacher, he taught me that your body has a defense against all of these particles. And this is your respiratory system, right? So you breathe in air, and the idea is that the particles should stick into the mucus, and then you swallow that. And so your body is making about 1 liter of mucus every day, and then all this material is going into the digestive tract. Maybe it's attacked by acids and enzymes, and it has to be absorbed across a membrane before it can get into you. You have a lot of defensive mechanisms. And the way that works is there's a surface, and the air goes around the surface. There's a streamline of the air. These particles are rather large. They have a lot of momentum, and that means they don't make the turn with the streamline. They keep going forward, and they hit the wall. And the problem with the very small particles is that they don't have such a large mass. They're able to make the turn, and this means that they can penetrate very deeply into the lung. And the smallest particles you see here, the red particles in the small-sized range, they actually go into the lung, into the alveoli, and then, as you know, they're able to go directly into the bloodstream, and then they bypass all of those safety mechanisms that your body has. And so something that you inhale could be much more toxic than something that you would eat. And so even very small amounts of these compounds in particulate matter in the gas phase, they can have very large effects on the human body. And one of these, of course, is COVID-19. And in the beginning of the pandemic, we were being told to think about fomite transmission and to be aware of surfaces and washing your hands and so on. The World Health Organization reversed their position regarding the mechanism of transmission. They said that despite consistent evidence as to contamination of surfaces and the survival of the virus on surfaces, there are no specific reports which have directly demonstrated fomite transmission. In conclusion, the World Health Organization, the Centers for Disease Control, and scientific research all suggest that the risk of COVID transmission through fomites is very low. The World Health Organization came out and said that airborne transmission is the main mechanism for transmission. And this means that in a healthcare setting, we have to be very aware of indoor air quality and ventilation. And a room like this, we might have, I don't know exactly, but I would imagine it's something like 5 air changes per hour. And that's based on how much air each person needs and just what is recommended as safe. Now, in many healthcare settings, you would like to increase that to something like 16 air changes per hour in order to reduce this risk of airborne transmission of disease. And a problem that we often see is maybe you have older buildings, maybe you don't have a good budget for maintenance, and so you'd like to know how you could achieve the higher ventilation standard when you don't have the ability to control the infrastructure. That's the background. There's a lot of indication that air pollution is a cofactor in the pandemic. And the reason is twofold. For one thing, your membranes and the respiratory tract, they become damaged by air pollution. And it actually dries and cracks, and this increases the surface area. It also suppresses the level of antioxidants that you have in the lung fluid. And these mean that viruses have an easier time attaching into the lungs, so you're more susceptible to the disease. In addition, it suppresses the immune system, and this means that you also have a greater chance of becoming infected. And so these studies have shown here that particulate air pollution contributed to 15% of COVID mortality worldwide, 27% in East Asia, the air is worse there, 19% in Europe, and 17% in North America. So by controlling indoor air quality, we can also help to reduce all airborne transmission. And this is a regulated area according to building codes and according to professional societies. So the World Health Organization has defined standards for ventilation and air purification in order to prevent disease transmission. It should be 10 liters per second per person in a non-residential setting, and much higher, 60 liters per person per second in a healthcare setting. So you really would like to, if you know there's a risk of transmission, you would like to have an increased standard of ventilation. The United States has the Clean Air in Buildings Challenge. You should improve indoor air quality. The United Kingdom has the Clean Air Bill, which is a pending bill, and it has regulated the indoor air quality standards. And the National Engineering Policy Center has recommended a reform of ventilation and air purification standards, including buildings and public transportation. Belgium as well has increased its regulation of indoor air quality. Now, there's two ways to achieve a higher standard of ventilation, and this is through a combination of mechanical ventilation and purification. And you add these two together, and that gives you the total ventilation. And so what we're suggesting is that you could have the HVAC system, the heating, ventilation, and air conditioning system, providing mechanical ventilation, but then supplement this with an air purifier, such as this one sitting right here. And this has HEPA-grade air purifiers in it that are collecting all of that particulate matter. All viruses, all bacteria, and spores are being trapped inside of this filter, and then they're killed using a sterilization lamp, using a UV lamp. A lot of times, ventilation could be uneconomic, and already a lot of energy is being used simply for ventilation. About 25% of world energy consumption is going to controlling this indoor environment. And if you increase the ventilation rate, you also increase energy loss by the buildings. And so this can also be an alternative that helps you to reduce energy use or improve the energy economy of the building. Now, the World Health Organization, the Centers for Disease Control, and the United Kingdom Scientific Advisory Group for Emergencies, the UK SAGE group, are recommending that air purification is a very good substitute in cases where you cannot ventilate. And the CDC says these air purification systems reduce the concentration of airborne particles, including the SARS-CoV-2 virus, without the need for conditioning outdoor air. And the SAGE group says these air purification devices based on HEPA filtration and UVC are recommended for settings where the ventilation is poor. The way that this works is that we would trap the particles on a filter, a HEPA filter, that's sitting in a cylinder in the base of this unit. And then the air is being drawn into the top. You see it's on wheels so you can move it around easily. And this induces a flow in the room. So there's a toroidal flow. The air is coming out the bottom, it goes up, and then it comes down. And this is called a displacement flow. In some settings, you might have a turbulent flow of air, a rather confused flow, and so then it's easy for one person to contaminate another person because the air is moving back and forth. When you have this displacement flow, the air passes you one time, and then it goes around, and then it's collected. So it's providing clean air, but it's also providing a flow pattern that helps to reduce the spread of disease. Inside of this, there's a UV lamp that's shining all the time on the inside surface of the filter, so we trap and then we kill the pathogens that might be present in the air. We're taking in air 360 degrees around. There's a control panel on the top. There's a high efficiency, high power fan in the top of this unit, and then that's putting the air down inside the cleaning unit. Now, there are different sizes. We have a small, flexible unit called the Compact 460, which is suitable for healthcare consulting rooms, small offices, and homes. There are 5 different airflow settings, delivering between 90 and 460 cubic meters per hour of purified air. These have been tested. These filters trap 99.97% of the particles that enter. We also have a larger unit. This is the Core 560, and this is providing between 300 and 560 cubic meters per hour of clean air. This is suitable for hospital wards, aerosol generating procedures in treatment rooms, large indoor spaces, and open plan offices. These are using the smart building concept, so they have sensors inside the unit that sense the indoor air quality and can be linked so that a space like this could have a single air treatment system that also would be logging the data. And so then you're able to improve the air quality, but also document what the indoor air quality is. And Rentzair, from its very beginning, has been working in the healthcare sector. The founder's son was suffering from asthma, and so he invented this air cleaner in order to help his son. They've been working in Danish hospitals for a long time, also Norwegian hospitals, and now they're working very closely with the National Health Service, the NHS, in the United Kingdom. It's the only air purification company that is an associate member of the National Health System Confederation. Now, these air purifiers are being used throughout the healthcare system. This includes primary care, could be general practitioners and dental surgeries, also in hospitals, general wards, respiratory wards, spirometry, endoscopy, and radiology, and certainly in care homes where you have people who are vulnerable to airborne transmission of disease. A lot of work has been done in order to validate the performance of these systems. Starting from the left, we have a study at the Oslo University Hospital, and this independent statement concludes that the Rentzair air cleaner effectively reduces the level of microorganisms such as bacteria, viruses, mold, and yeast in the air. The National Health Service biovalidation says that they achieve a 99.9% reduction, a log 3 reduction in airborne pathogens per cubic meter of air in 34.2 seconds. There's a report by Eurofins. This is a large analytical chemistry laboratory. They say that the test of the air cleaner's excretory degree, the efficiency indicates that 99.89 and 99.96% of 0.3 micron and 0.5 micron particles are being removed. And finally, the ESI group, this is a pioneer and world leader in predictive physics, modeling, and virtual prototyping, concluded that the Rentzair upper unit intake captures the flow hemispherically from above and around the unit, while the lower unit radial air outflow jet attaches to the floor. So you have this toroidal motion, this displacement flow. These two factors enable the unit to purify all the air in a room. Very simple maintenance. There's certain intervals for changing the lamp. This is a fluorescent lamp. It's a UV lamp, but very similar to the fluorescent lamps that are very frequently used. It has a certain lifetime. In addition, you have to change that filter, so you just lift out that cylindrical filter and put in a new filter. It's like maintaining a vacuum cleaner, very, very straightforward. And in conclusion, I believe that there are many benefits to this Rensair air cleaning system. There's undisputed evidence that demonstrates that cleaner lungs equals better health. It can mitigate against the risk of airborne transmitted disease, including seasonal flu and COVID, and significantly help hay fever sufferers and asthmatics by removing pollen and airborne irritants. It improves productivity, and there are studies showing that the productivity in offices drops when the indoor air quality is not good. It also helps to reduce energy use by reducing the need for outdoor ventilation, and competitively priced and an instant tailor-made solution. And so we're very happy to talk more with you. And there's a stand outside, and we have a distributor in Lithuania. So thank you very much for your attention.